Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Gold standard investigation for endometrial cancer include the fractional curettage is a gold standard investigation. Fractional curettage is an OT procedure where we divide the uterus into fractions and curating is done from each fraction. Fractional curettage is better than dilatation and curettage. The indications of fractional curettage over endometrial biopsy include: first, report of endometrial biopsy. If on report of endometrial biopsy, if the sample says inadequate, then we can do fractional curettage. If the report of endometrial biopsy says that there is hyperplasia with atypia, or if endometrial biopsy report is normal and the patient continues to bleed, then we should do fractional curettage. If there is cervical stenosis, then we should do fractional curettage.
thank you and thank you for watching.